I'm here with Mindy Reed, who's a physical therapist, and we're going to talk a little bit about physical therapy ethics and professionalism. So Mindy, how long have you been a therapist, and tell us a little bit about yourself?
Hi, my name is Mindy Reed. I'm a physical therapist. I've been a PT for going on 21 years now. I graduated in 1989, and I've spent most of my time in either acute care, but the last 14 years have been in skilled nursing, working with geriatric patients.
Very cool. So in a typical day, you have a lot of people to see, and there are times when you can't see everybody. Who do you decide to see in your last half an hour if you have 3 people on your list?
Well, because we have such a good boss here, that doesn't usually happen.
Good.
But, so I would have to go back and say the manager has to be the one to schedule things appropriately, because in this setting, every patient does need to be seen, according to the plan of care and Medicare and all that. But if it came to that situation, the first thing I would do is I would go to my supervisor and say, I only have 30 minutes left in my day. I have 3 people to see. Who would you prefer me to see? So I would wait to see what the supervisor said. But having been a supervisor also for many years, if somebody came to me and asked me that question, a couple of considerations go into that. Unfortunately, in this day and age, Medicare and insurance companies play a big part in what we do here. And a lot of how we get reimbursed through Medicare is how many minutes a patient gets in a week of therapy. So that goes into one decision. That goes in part to the decision as far as are these minutes required for this patient to get the Medicare reimbursement that is wanted of us. So that would be one thing. The other thing would be is who would clinically best benefit from what little time we would have together. So maybe somebody that's higher level, that's a little bit more independent, might not have as big of a need for physical therapy versus somebody that's just getting started, is a little lower level, needing more assistance with transfers. You might just be, so those kinds of considerations go into.
So I'm going to put a scenario out for you.
Okay.
You have 2 patients that are yet to be seen, and you're the acting supervisor. And one of the patients is a retired physical therapist who has had a total knee replacement 3 days ago with no other complications. And the other patient has Parkinson's and has had a recent hip fracture from a fall. And so the patient with Parkinson's has not gotten out of bed yet today. And the person with the total knee replacement is retired PT, kind of knows what's going on.
Kind of knows what's going on.
So who would you pick?
How much time do I have?
You have 30 minutes.
30 minutes?
Yep. End of the day, and you need to go pick up your kids after
End of the day.
school. Yeah.
That is a tough question, Mark, because in that situation, I would say they both need it.
Yep.
They're both orthopedic patients that need to be up and moving. So I would split my time.
Okay. 15
I would
and 15?
do 15 with the retired physical therapist and 15 minutes with a Parkinson's patient that just fractured their hip.
I like that.
That's what I would do.
Yep.
15 minutes isn't very long, but at least they get out of bed, they can walk, and a lot of times patients that are on physical therapy, the most important thing is they want to be able to walk. So if they feel like you've spent time with them doing that, which is usually one of their goals, I think, and you could also explain to them, just say, this is a situation, I'm sorry I don't have as much time as I would like, but I do have this amount of time and we can get this done. And then tomorrow we'll do more.
Okay, the last question is, you have a patient that has met their therapy goals and they do not want to leave. They don't want to leave. They love the food here. They, they think you're the best therapist. They don't think that they're ready. And their families says, they want to stay, so can't you see them for 2 more days, even though they've met all their goals, short-term and long-term goals. And let's say the patient is somebody who has had a hip fracture. They've been here for 2 months, and they're up and walking now independently to the bathroom, still stiff, still some pain, but they're independent in their room. But they still want to stay, because they feel they're not better. They feel, you know, if I could just stay for another week.
Okay. I have had that happen, and sometimes what we've done is compromised and said, okay, well, we can do a couple more days, but a week probably isn't necessary. And I sit down and I explain to them why. So I would say, okay, these were the goals that we had. You've met these goals. So then I try to get them to tell me what is it that they feel that they still cannot do. And if they can't think of anything, and a lot of times they can't, if they know they can get up and get themselves to the bathroom, they can get themselves dressed, they can walk to the dining room. So you kind of put it back in their court. So try to get them to think about what things they need to do that they don't think they're able to do. And you try to get them to see that they really can be on their own. Okay. And try to reassure them that they're going to be safe, they're going to still have home health therapy following. A lot of times people don't realize that. They think once they're leaving here that therapy's done. And a lot of times they're reassured when they know that they're going home and in a couple of days there's going to be a home health therapist there to follow up and continue seeing them. So a lot of times that's comforting too, to know that therapy is not ending. You're just moving on to another stage. You don't need this level of intensity. You'll be fine doing therapy 2 or 3 times a week versus 5 or 6 times a week in this setting.
And so really you're doing ethics in action, because you're making the decision to have that tough conversation with the patient versus making a choice. Well, you know, they're done, right? You're making that choice to explain to them, to take the time, and oftentimes that takes that situation of anxiety and such and just shifts it by taking the time to talk to them, explaining to them that their goals have been met, and putting that responsibility back into them.
Exactly.
To come up with a new treatment goal if they have one that's measurable and functional, right?
Right.
Yeah. Good.
Yeah.
Well, I think that wraps it up with Mindy. I have somebody else waiting here that wants to talk to a little bit about her preparation to getting licensed as a PT assistant. But I thank you so much for spending your time with us today, and any closing words?
Keep working hard, enjoy what you do, and that's the most important thing. You gotta like what you're doing. If you don't, it's hard to come to work every day.
Yeah.
So you've obviously chosen this for a reason, so.
And how many years experience have you had?
21.
21.
Yeah.
And you're not burnt out yet.
I'm not.
That's good. Thanks, Mindy, so much for your
You're
time and all
welcome,
you do.
Mark. Thank you.
Gift to the profession. Come on over, Heidi. Thanks again.
Yeah.
So I have Heidi Martin with me, who's going to introduce herself and tell you how long she's been a physical therapist assistant.
I'm Heidi Martin, PTA. I have been a PT assistant for 10 months, I believe. I can't believe it. It's almost been a year. So, yeah.
Very cool. And then why did you enter this profession? And give us a little 1-minute spiel or 2 minutes.
A 1-minute spiel. Okay. I got into this. I worked in an office and as an aide/tech for an outpatient chronic pain clinic, and really liked it and liked doing, you know, all the tech work and everything and working with the patients. So the PT and the OT suggested that I go back to school and get into it and do more of the hands-on stuff. So
very cool.
Yeah.
You have a background in exercise science. Is that what your undergraduate degree is in?
Bachelor of Science in that, and then taught dance for a year, ballroom dance, and really liked the instruction part of that. So kind of liked carrying over that part of it.
Very cool. So students are getting ready for the licensure exam. It's a high-stakes exam, as you well know.
Oh yeah.
The pressure's cooking. You've been there just less than a year ago. What advice would you give them? Students have the book to review, to practice tests. Their exam's going to be in July, so they have less than 2 months until this exam. What would you advise in terms of having a resource of a book and getting ready for this thing?
Well, I personally didn't use the study book. I used the online resources, which was easier for me. But they offer the 2 practice exams.
Yeah. For the FSBPT.
Mm-hmm.
Yeah.
And those were really, really helpful as far as giving an idea of the setup and what the exam looks like and how you use it on the computers, which took away some of the stress because I didn't have to worry about, oh, I don't want to mess this up. But doing both the practice exams, taking the first one immediately, I tried to study for it and prep myself, and my advice would be just to take the first one and then study from those. And then study your notes. I went back after taking the practice exam and studied from my notes on my weak points. And also I started working the month before the exam, so having the hands-on stuff really, really helped.
You're working as a temporary license?
Yeah.
Yeah, very cool. So if you had some advice to students who have a book and have practice exams and who have not worked as an aide, and I know it's hard to put yourself into that shoes, what would you advise in terms of getting ready for this high-stakes exam, knowing that they're very anxious?
Yeah. I'm anxious just reliving the memories of it. I would say, try to set up a study schedule. Like plan it out so that you're giving yourself breaks so you don't burn yourself out, because it can be really exhausting. If you're able to, even if you're not working, maybe shadow at clinics so that you're still like within at least somewhat like the lab simulation setting, just so that it's a little bit more realistic. And then just based off the practice exams, even in the books, it'll help you because they have practice exams in there too. Mm-hmm. And take them, read. They give explanations for every correct response, every incorrect response. Read them both, because even if you answer a correct response, you may have answered it for a different reason than what they were meaning. Mm-hmm. So it's good to just see what they're looking for.
Did you feel prepared?
No.
Not okay?
No. I was super stressed out. But in the end it was fine. It's hard to prepare for something that is so intense and such a long test, and even, hours of studying, being in the environment, it's a stressful test.
But you passed?
I passed.
Yeah.
I passed. And everybody told me you'll feel like you bombed it, but everybody does okay. So. Yeah.
So, without mentioning the school you went to, how much did they prepare you for licensure exam in terms of practice tests and opportunities to practice?
I feel like it would have been helpful to have somebody maybe who had just taken the test, or like maybe somebody from the previous year come in and kind of reiterate, because they really did stress taking the practice exam first right off the bat, and then going for it. And a lot of us in my class, we didn't follow it. We wanted to be prepared, so we studied, and then it felt like we didn't have enough time after we took the practice exam. So take it right away and just get it over with. Even if you score terribly on it, it's a really good resource. And I think that they did. As far as being prepared for the actual test, I felt like we covered everything at some point.
Good.
It's just so much information that it was regurgitating within the 4 hours of the test. But yeah, I thought they did a really good job of hitting all the, especially the safety points. That was, I think, probably what I scored highest on all the different exams practice, and the real one was all the safety stuff. So.
And final question, did you feel great with the neuro?
No.
Okay.
No, not at all. Studying like dermatomes, spinal nerves, anything like that, what is affected by spinal cord injury, there was a lot more on the test than I thought that what we covered in the program,
Okay. So
and
study
more
those
intense.
dermatomes, study the myotomes, study the motor levels,
Yes,
right?
yes.
Really go over what's the difference between incomplete and then the complete spinal cord injury, the Asia impairment scale. I'm sure all these words are
Yeah.
going back to, oh yeah. All important stuff.
Yeah, and that is a really good thing that I learned from the practice exam, is that on the first practice exam, there was an overwhelming amount, it seemed to me, because it was my weakest point of the neuro and the spinal cord. And so that's what I really focused on. And then I did better in that section for the second practice exam. It made me feel a little bit more confident to go into the real thing.
Good, good. Well, thank you so much,
Thanks.
Heidi. Yeah, we're glad to have you here working here. You're
Thanks.
awesome.
Thanks. Good luck, guys.